Work will continue without fear. This is after Limpopo Health MEC Dr Phophi Ramathuba administered vaccines to scores of journalists from various media houses. For more, the MEC joins us now live to discuss this via Zoom. MEC Dr. I don't know which one comes first. You can guide me on that. Welcome to the agenda. Good to have you on the program.
Morning, Blair, and morning to all your viewers, and thank you very much for inviting us.
Now, it's a pleasure having you on the program, especially to get a sense of what's happening on the ground. But there's been numerous calls for heightened protection for frontline journalists, video journalists, producers, etc., etc. We have lost colleagues in this industry already. Vaccines offer a layer of protection. It must be said that you still can contract the virus, but it adds this protection, it prevents severe disease. That's what we're told. What's happening in your province? Your province is no doubt rising to the challenge and vaccinating journalists. Why?
Look, as you have indicated, from day one, when we detected the first case, March 16, 2020, we were with journalists. They were the ones who were informing the public, actually long before we could even detect our first case. They have been moving around the province, educating the public. Our messages were received by public because journalists were there. There were more frontline workers than even some. I make jokes with my staff sometimes to say, some of you are sitting in offices, but journalists are out there as field workers. And not only those that are going into the field, including yourself. When we come, those who come from the field, they come and interact with you, putting your life also at risk. So that is why we felt as a province, we need to prioritize our journalists and bring them together and vaccinate all of them. The second issue which made us to say, let's have this special day for vaccinating our media houses was the fact that because of the nature of their work, sometimes they work from morning until midnight, and sometimes they don't even see a break. So when will they get the time to say, I will go to the site and be vaccinated? Now, when they are in their field of work, when they're busy covering the story, let's make sure that we put a day aside and vaccinate them and say they don't have to come for a queue. They must be given that special attention so that they can be able to get their vaccine. The third reason was that we know when fake medias come to the public, they reach to your hands and to your ears as the journalist. Now, you are the one who's supposed to report or assess whether this is fake news or whether it's authentic for reporting. Now, it will be important for you to have the first-hand experience on this vaccine so that even when there are all these reports about vaccine does this and that, you would know because you would have been vaccinated and you will know and understand what you are reporting about. And lastly, and most importantly, is that to our benefit as the public health activists, journalists have got many followers who listen to them. So if a journalist go out and say, I've been vaccinated, vaccines work, we were going to have millions of our citizens to believing in this particular vaccine. So that is why, as a province, given those four reasons and that background, we felt it important to make sure that our journalists in the province, whether print or electronic, all of them, all the journalists should be given that particular priority. Whether you are in the field or you are in the producer or you are in the office, all of you must come and join us and be able to be vaccinated. And we feel comfortable. And for me, lastly to you, is that because I've been working with you in the field, I was always feeling guilty to say I am vaccinated. Because if you remember, I was vaccinated on the 19th of February. I was vaccinated, but the journalists, these field workers, these frontline workers who are entering COVID-19 wards with me to report the stories about COVID-19, they are not protected. These journalists who, when the story break in Beit Bridge, where there's congestion, they are there, but their immune system is not boosted. They are not protected. So that guilt continuously haunts me. And I can tell you, I slept peacefully on Thursday, knowing that the people that we're working with, whether it's police, whether it's traffic officer, whether it's journalists, they've now received their vaccines, and therefore the work will continue, and even vaccinating the public will become much more easier because the frontline workers have been vaccinated.
Know that this democracy won't work if we don't have an informed citizenry. And that's what journalists do. They inform. You alluded to the power that the media have. Vaccine hesitancy. I know you know this, but for the benefit of the audience, it refers to this delay in acceptance or refusal of vaccines despite availability of vaccine services. It is influenced by a number of factors such as complacency, convenience, confidence in the actual vaccine. Any concerns in Limpopo that you picked up with regards to this issue?
The concern has been there throughout, even in our province. That is why, if you remember, when we started vaccinating the healthcare workers, the president was one of the first people to be vaccinated, and the minister at that time. And then followed by, in our province, I was the first person to be vaccinated because we wanted to send a message as government to say, the vaccine, there's nothing wrong, because if the first citizen of the country is being vaccinated by the very same vaccine, that means there's nothing wrong with the vaccine. When it comes to us, healthcare workers, we were able to win, but there are few who still were hesitant and they refused to be vaccinated. And it's very sad because, truly speaking, the healthcare workers that I'm currently losing are those ones who refuse to be vaccinated. Majority of the healthcare workers who are currently testing positive, they are not even they don't even know that they are positive. We picked up as we will be tracing contacts of those who are positive. We are not having healthcare workers in our ICUs who have been vaccinated fighting for their lives. We are not signing death certificates of our healthcare workers who have been vaccinated. That is a fact. Now, when we move to the second category of the above 60, what we did, we also approached our church leaders. Remember, we had our bishops to be vaccinated because we believe our province, traditionally, it's a rural province which believes in we are too religious in our province. So what is important is that know your constituents. We believe in our traditional leadership, traditional healers. So those were the categories that we prioritized and gave special attention to vaccinate.
Right.
Now, when we move to the 35 to 49, to deal with this hesitancy, journalists, you play a major role on this category of the 35 to 49. That is why you see us vaccinating, especially you. When we move to the 18 to 34, the below 34, we are also going to identify people who are role models to that category. So when you deal with each sector, or each cohort, try to look at those that they believe in. The fact of the matter is that our people do not believe in us as politicians, but they believe in their own role models, which could be media personality, which could be church leaders, which could be traditional leaders, which could be traditional healers. So all those categories in Limpopo, we are working close with them. So that's why you see the receptiveness in terms of the vaccine. When we open a site, more than 1,000 people pitch up to want to be vaccinated.
You know, I just said earlier on that I received my first jab on Thursday, but it's not for me to force people to vaccinate. We present the facts as journalists to the people. It is for them to decide what it means for them and for their family. Are you getting a sense that people rather be educated about the vaccine so that they can make up their own minds rather than some people's reluctance to be, for a lack of a better word, indoctrinated by government and others?
I think what is important is that educate people. And as I've indicated, use the people that they believe in to be able to educate them. When you have a third party telling your story, it's much more effective than you as the MEC Ramathuba telling the story. Now, as a medical doctor, when you talk to your patients, sometimes they will not believe. By the time people present to a medical doctor, they have already gone to many traditional healers. Now, if the traditional healer is to say to them, I've been vaccinated, the vaccine has been able to protect my life based on 1, 2, 3, 4. The very same patients whom we are sharing with the traditional healers believe in traditional healers than they believe in us. And let's not shy away from that. No matter how educated we are in South Africa, I can tell you, I work with the community on a daily basis. And I can tell you the very same message that I give to the community. If it's presented by you, it's more accepted than when it's presented by me. So what is important is that I agree fully with you. Let's educate our people. And who do we use to educate our people? We must use the people that the people themselves believes in, community leaders whom they've got faith in. So if we undermine our community leaders and think we know it all and think we are scientists and think we are political leaders and forget about the society that we lead has got its own leadership that they've identified as their own role model. We're not going to win in this battle. So for me, I've seen yesterday we were visiting quite a number of malls. The other issue is the peer pressure that we see happening, especially with the current 35 to 49. Immediately when they see a long queue of people at the mall saying we're going to be vaccinated, all of a sudden, all of them come in and want to be vaccinated. But when they see more messages of fake news being occupying our space, we're not going to win with this battle. So my advice to many of my colleagues, especially those who are in the public health space advocating for vaccine, let's work with the people on the ground. Let's be able to work with everybody and not push away those with negative beliefs. Sit down with that person, make time. I'd rather spend 30 minutes with someone whom I know is very negative about the vaccine, educating that person, presenting facts to that person, because I know by convincing that one person, I have got 10,000 followers of that person who will be able to get to the vaccine. Unlike me focusing on those who believe in the vaccine, I always believe in my opponent, and that has made us to survive up to so far.
Are you vaccinating on the weekends as yet in Limpopo?
Yes, we are vaccinating on the weekend. We have come up with our campaign of focusing on our malls over the weekend because one, the people who work, the staff that works at the mall, they don't have time. They all work long hours like healthcare workers, like media houses. So most of the time, by the time they knock off from checkers, it's late. The vaccination site is closed. We have also seen that people over the weekend want to go to the malls to buy. So in your plans of buying groceries, we always invite you to say, here is the vaccine. I can tell you the vaccine stations that we opened yesterday, they did extremely very well, few as they are, compared to even when we vaccinate during the week. So we will continue with the weekend vaccination. We are also working with our treasury. We made our presentation to say healthcare workers over the weekend, we have to pay them their overtime because we can't expect them to be working all these hours and sacrificing their families without us looking at their own interests. It's not all about money. I can tell you the kind of the workforce that we're working with in the province, they don't mind to knock off at 10. As long as there's a person waiting to be vaccinated in the station, they will never knock off. So that is how fortunate as the people of South Africa are. We've got majority of our healthcare workers very passionate, understanding that we can defeat this virus by fighting it on the street, and vaccination is part of the primary prevention, which is a weapon that we can use to defeat it. Because defeating this virus in our ICU, we have seen it. It's very, very difficult. Defeating it once you get into that ventilator, I'm not going to lie to you, I do not wish for anyone to happen to be seen in that ventilator. We've seen people succumbing once they get into that stage. But vaccination, it's a primary prevention and it's a key weapon towards making us to defeat and win. And lastly, don't you wish for us to go back and watch our soccer matches? Don't we want to go back to normal? Don't we want us to work without masks? Don't you want us to get our economy running, getting everybody back to normal? So if we are to vaccinate that 67% of our population, we can easily go back to that life that all of us want to. And most importantly, we can preserve and save lives. So if we can't do it for anything, let's do it for preserving and for saving our lives.
I can't agree with you more. We need to get to a better place and as quick as possible. We are learning about the deleterious effects of COVID-19 every day. Sometimes it's trial and error, but I think don't let perfection be the enemy of progress. We need to keep on progressing in our fight against COVID-19. MEC, we thank you very much indeed for your time. Have a great Sunday.
Thank you very much, and continue to do a good job as journalists. Know that as healthcare workers, we really appreciate the good work that you do when you tell our stories.
All right, be well. God bless. Limpopo Health MEC there, Dr Phophi Ramathuba. In other news, preparation for the relaunch of the new South African Airways underway. So far, the new management has prioritized the renewal of expired safety licenses. The strategic equity partnership with the Takatso consortium has not yet been cemented, we're told. SAA has